When working with an older adult, getting peripheral vascular access is incredibly important because their comorbidities are usually large. There's usually a lot more working with an older adult than a younger person. So even if they're presenting with a temperature, they probably have a history of heart failure. Or if they're presenting with chest pain, they probably have a history of pneumonia, something like that. These are all things that can be treated with IV access, whether it's fluids or medications. When you don't do that, that'll be the patient that crashes on the way to the hospital. So it's really important to have it and not need it than need it and be too stuck to get it. In the older adult, rapid vascular access is very important when they're very sick, obviously, that goes without saying. With somebody who presents with pneumonia symptoms, they can go septic in a matter of minutes. Their pressure will drop and they can still be slightly mentating. You won't know that they need the access that you needed to put in a while ago. The fluid, you just keep pushing fluid, and that's the only way you're going to save them to get them to where they need to go. Giving nitro to an older adult, they're going to respond badly to that a lot of the times. You don't want to give somebody nitro without an IV access and have their pressure drop and have no way to save them. Now you've created another problem, and all you needed to do was have the IV access to save that. And somebody who, unfortunately, Alzheimer's or dementia, by getting that access rapidly, you can give them medication to calm them down or, give them what they need to help them out.
There are many situations where a peripheral IV need to be established in the adult. And in a short podcast, we're not going to be able to go over all of them, but certainly older patients are more prone to things like hypoglycemia. There are more diabetics where you need to get an IV in and give them the D50. And one of the things that's interesting in these patients is because as we age, we do not have the glycogen stores in our liver. They are far more likely to need the intravenous dextrose than the glucagon that you would normally give IM, so you may not see as good a result. Other things which have to do with cardiac and breathing problems, you are going to need IV access for the administration of medications, and you need to rapidly start the IV in order to improve their outcome. And essentially, as you get older, several things happen. The skin thins out. This is made much worse in certain types of patients, patients with chronic obstructive pulmonary disease, as we all know, anybody on steroids, and it makes the skin far more prone to tear. So you have to be more careful when you start an IV, and it may be more difficult to actually tape the IV down and to get it to stay in place. Other than that, you should have an easier time in many older patients because you lose a lot of subcutaneous fat and it brings the vessels closer to the surface. As we get older, several things happen within the blood vessels. I think as everybody has learned, they get calcium in their blood vessels, they get very hard, the veins tend to roll, and it is much more difficult to start an IV in these patients. One of the things that helps is to use your free hand, your non-dominant hand, to kind of tether the vein as you're putting in the IV. That will help stabilize it and keep it from rolling. Other things that have been talked about to improve your ability to start an IV is tunnel it farther on the skin in an older patient, which helps to pin down the vessel prior to the establishment of the IV. The other thing is that the valves are much harder and more firm in the older patients, and if you're up against the valve, you will not get return or have impedance to flow in the IV. One of the things that you can do if you have a helper is to have them tether the arm, meaning take the skin and use your hand to kind of pull the skin taut, which makes it easier to actually get the IV within the vein.